This is the model of hip bone. This is the two hip bone, the ilium, pubis, and the ischium. And this is pubic symphysis. Here is the sacrum. This is in white color. This is the acetabulum. This is in red color. This is the head of femur. This is shaft of femur. This is greater trochanter. This is lesser trochanter. And this is the model of the hip joint. First, articular surface. The articular surface, it is proximal and distal. Proximal, that is in the hip bone, and the distal, that is in the head of femur. The acetabulum in white color. Within it, there is a lunate surface. Articular surface is lunate shaped in yellow color. It is covered by the hyaline cartilage, except in the center and inferiorly. In the center there is white thing, that is areolar pad of fat, and inferiorly this is the transverse acetabular ligament. This one is the transverse acetabular ligament. Okay. This articular surface, lunate articular surface, it is deficient in the center, which is taken by the areolar pad of fat, and inferiorly there is a notch which is called acetabular notch, which is converted into a foramen by the transverse acetabular ligament, within which this black color intracapsular ligament, that is the ligamentum teres femoris. This is head of femur, it lies within the acetabulum, but I have pulled head of femur outside so that we can see the internal structure very much clear. So at one end, this ligamentum teres femoris is attached at the fovea pit, at the fovea or pit, fovea capitis, and at the other end it is attached to the acetabular margin. It's the margin of the acetabular notch as well as the transverse acetabular ligament. This black one is the round ligament of femur. Okay. Now coming to the articular surface, it is lunate shaped within the acetabulum and covered by the hyaline cartilage, whereas in case of distal articular surface, it is in red color. This is the hyaline cartilage which covers the whole of the head of femur except fovea capitis. So these are two articular surface. Now coming to the fibrous capsule. Fibrous capsule, it is green in color. This green one is the fibrous capsule or capsular ligament, which is attached at the acetabular margin. That yellow one is the articular surface of the acetabulum, and this white one is the acetabulum, and this is the acetabular margin. At the acetabular margin, this fibrous capsule is attached all over. Okay, all over, all around, in the proximally and distally. It is attached in green color. This one, it is attached at the base of the greater trochanter. This is our greater trochanter. At the base of the greater trochanter, then intertrochanteric line, and then base of the lesser trochanter, and behind medial to the intertrochanteric crest. Suppose this is intertrochanteric crest, the fibrous capsule, it lies medial to that. And one thing worth mentioning, that there is a gap in between the bone and the fibrous capsule posteriorly, which give passage to the retinacular branch of the femoral circumflex femoral artery. Okay, which is the very much important for the head of femur. Okay, now coming to the synovial membrane. Synovial membrane, this polythene, this one. Synovial membrane is a closed serous sac. It lines the fibrous capsule from inside, as well as the ligamentum teres, this black one, ligamentum teres, as well as the neck of femur, and also transverse acetabular ligament and the glenoid labrum. Whole of this is lined by the synovial sheath, which is a double layered. It is a closed sac. I have shown as if I have cut the sac. That's why there is two layers, within which there is synovial fluid inside. Okay, now come to the glenoid labrum. Now what is glenoid labrum? This red one all around the acetabular margin, that is glenoid labrum. This head of femur is more than half of a sphere, and to accommodate it properly, the fibrocartilage is attached at the margin of the acetabulum, that is called the acetabular labrum. Acetabular labrum is even attached at the transverse acetabular ligament, which is in between the acetabular notch. Okay. Now coming to the another ligament, that is the in black color. This is the ligamentum teres, which I have said earlier. It is triangular in shape and apex is at the fovea capitis and the base is towards the margin of the acetabular notch as well as the transverse acetabular ligament. It carries the artery to the head of femur, that is the acetabular branch of the obturator artery and the acetabular branch of the medial circumflex femoral artery. Okay, now another ligament is this black one. This is the iliofemoral ligament. It is Y-shaped. The stem of Y is attached to the anterior inferior iliac spine, and there are two limbs. There is one vertical limb and there is one oblique limb. This is also known as lateral oblique limb, and this is medial oblique limb, which is somewhat vertical. Lateral one is attached at the upper end of the intertrochanteric line, just below the greater trochanter on the anterior aspect. And this is the vertical limb or the medial oblique limb, which is attached below at the intertrochanteric line. It is superiorly placed, the lateral oblique line, and medial oblique limb is attached inferiorly but on the anterior aspect. It is very much strongest ligament of our body. This is the strongest, also known as the ligament of Bigelow. Now second one is the, in yellow color, this is the pubofemoral ligament. Pubofemoral ligament is attached at the obturator crest, then superior ramus of the pubis, and then iliopectineal line. Okay, and distally it is triangular in shape, and distally it is attached to the lower part of the intertrochanteric line on the anterior aspect, but deep to the iliofemoral ligament. Here is the site of insertion. And third ligament is this yellow one. This is the ischiofemoral ligament. It starts from the just behind the at the ischium, just by the side of the acetabular margin, and now it is coming anteriorly and insert on the upper part of the intertrochanteric line, just at the base of the greater trochanter, and deep to the iliofemoral ligament. Okay. All these three ligaments, they resist extension. This iliofemoral ligament, this resists extension as well as the lateral rotation. This also resists extension and lateral rotation. And this, that is the ischiofemoral ligament, it resists extension and the medial rotation. So this is all about the ligament. Now coming to relation of the hip joint. Anteriorly, from medial to lateral, it is related to, in white color, pectineus muscle. Then in yellow or orange, this is iliopsoas. This one is iliacus and this is psoas major, and even lateral to that, this is rectus femoris muscle. Now coming to pectineus muscle. Pectineus muscle, it arises from the body of the ventral surface of the body of pubis, and then this white one, it is going downward, and then here it is inserted on the pectineal line, on the upper posterior surface of shaft of femur, over the pectineal line or a spiral line. Then comes iliopsoas. This yellow one is the iliacus muscle, which takes origin in the iliac fossa and get inserted along the lesser trochanter. And this one is, orange one is the psoas major muscle, which arises from the anterior and the lateral surface of the T12, L1, L2, L3, and it at the level of the inguinal ligament, it combined with the iliacus muscle, and then as a whole iliopsoas get inserted over the lesser trochanter. This is iliopsoas, this one is iliopsoas, and then it get inserted here over the lesser trochanter on the anterior aspect. Here, this one is the insertion of the iliopsoas. Then comes rectus femoris. This is the straight head of rectus femoris. Frankly speaking, the straight head only, and the reflected head comes under the superior relation, and the straight head comes under the relation of anterior relation of the hip joint. So a straight head, it arises from the anterior inferior iliac spine, and then along with the reflected head, it get inserted over the tibial tuberosity after crossing the patella. First over the superior margin of the patella, and then finally inserted over the tibial tuberosity as the ligamentum patelli, along with other component of the quadriceps femoris. Now this is the anterior relation. Now coming to the superior relation, this one, this is the gluteus minimus muscle. Gluteus minimus, it arises in between the inferior gluteal line and the anterior gluteal line over the gluteal surface of the iliac bone, and then get inserted over the anterior aspect of the lesser trochanter. Okay, greater trochanter. Anterior aspect of the greater trochanter. So this comes under the superior relation. Along with the gluteus minimus, there is also one thing more, gluteus minimus, as well as this one, reflected head of rectus femoris. This one, reflected head, it attaches just above the acetabular margin, acetabulum. Okay, so this also comes or the superior relation of the hip joint. Now coming to the inferior relation, there is this is pectineus. It is in the anterior relation as well as on the inferior relation. This is inferiorly, also inferiorly, as well as the obturator internus muscle. This in orange color. This is obturator internus muscle. It takes its origin, obturator externus muscle. It takes its origin from the external aspect of the obturator foramen. This orange one, external aspect of the obturator foramen, and then this obturator externus get inserted over the medial surface of the greater trochanter. Here, this one is the tendon of obturator externus, which comes under the inferior relation of the hip joint. So inferior relation, obturator externus tendon, and this one is pectineus, both in anterior and the inferior. Now coming to the posterior relation of the hip joint, or all the lateral rotators, that is the piriformis. This in pink color, this is the piriformis. It takes its origin from the ventral aspect of the sacrum. This is the sacrum from S2, S3, S4, ventral aspect. It takes its origin and get inserted over the posterior most point, that is called the apex of the superior border of the greater trochanter. Here piriformis is attached. Now another one is the obturator internus and gemellus superior, gemellus inferior. This in blue color, this is the obturator internus. You can see the inner aspect of the obturator foramen. It is covered by the obturator internus muscle. Now tendon of obturator internus it takes 90-degree turn here, and then along with here is the ischial spine, the superior, the inferior to the obturator internus tendon. This is in green color, gemellus superior, and in green color also gemellus inferior. All these three unite and insert over the medial surface of the greater trochanter, obturator internus along with the two gemelli. Okay. Now in the posterior relation, this is also sciatic nerve is there. Sciatic nerve, it comes from the pelvic cavity to the gluteal region, infrapiriformis compartment of the greater sciatic notch, and now it comes under the posterior relation of the hip joint. Okay, so this is all about the relation of the hip joint. Now coming to the blood supply of hip joint. Now this one is the artery to head of femur, which runs in black color. This is the Ligamentum Teres femoris, which is triangular in shape, and apex is attached to the fovea capitis femoris, and the base is attached at the margin of the acetabular notch. It carry the artery to head of femur, which is the acetabular branch of obturator artery and acetabular branch of the medial circumflex femoral artery. But this is not the blood supply by these arteries are not just enough. Mainly it is supplied by the retinacular arteries. This one is the, in orange color, this is the retinacular artery which enters through the anterior aspect in between the iliofemoral ligament and the pubofemoral ligament. This in black color, this is the iliofemoral ligament, the ligament of Bigelow, the strongest ligament, and this in yellow color, in here, this one. This yellow color, this one is the pubofemoral ligament. In between these two, this is the branch of retinacular branch of the lateral circumflex femoral artery, which enters through this gap, and then the defect in the fibrous capsule of the hip joint, which is created by the retinaculum, or defect present in the inner stronger circular fiber of the hip joint. The fibrous capsule or capsular ligament of the hip joint is made up of a strong inner circular fiber and weak longitudinal outer fiber. As the longitudinal outer fiber is weak, it gives way to the retinacular artery, but there is a space, small spaces, that is called retinaculum, present in the strong inner circular fiber of the fibrous capsule of hip joint, which give way to the retinacular branch of the lateral circumflex femoral artery. And posteriorly, this one, this is the retinacular branch of the medial circumflex femoral artery. Medial circumflex femoral artery. That is lateral on the anterior aspect and the posterior aspect. This is the medial circumflex femoral artery. And in the ligamentum teres, what I have said earlier, and that is the acetabular branch of the medial circumflex femoral artery and the acetabular branch of the obturator artery. And this is the retinacular branch of the medial circumflex femoral artery, which enters, which I have said earlier, there is a gap in between the, you can see this is a hole in between the joint capsule and the bone itself. It is not attached, the joint capsule is not attached here, just it is kept over there, but there is no firm attachment over there. There is a hole through which retinacular branch of the medial circumflex femoral artery, they are many in number and they are larger in size. So the main artery for the hip joint is this retinacular branch of the medial circumflex femoral artery. And the another one is this one, yellow one. This is the nutrient artery of the femur. But it is not it does not carry such amount of blood to fulfill the requirement of the arterial supply of head of femur. Okay, now coming to the nerve supply, the mnemonics focus, that is a femoral nerve, obturator nerve, nerve to quadratus femoris. U is just like the gluteal region, that's why it is superior gluteal nerve. And as for sciatic nerve, this one, focus. Okay, and one thing more I would like to mention, that in the synovial membrane there is a gap through which the synovial membrane protrude out, and the anterior aspect there is a bursa which lies in between this Psoas Major tendon and the hip joint. Here is one bursa, and behind this is there is obturator externus tendon, this one. Obturator externus tendon. In between the hip joint and the obturator externus tendon, there lies a bursa. Thank you.